You're watching The Source on CNN Philippines. I'm Pinky Webb. Our source today, PGH spokesperson Dr. Jonas del Rosario. Dr. Jonas, welcome to The Source, and also thank you for your time. First, I want to ask, how is PGH? What is the status of the hospital utilization over there now?
We're still full, Pinky. We have basically almost 100% of our beds are occupied. Just to give you a picture, we have 300 beds for COVID. We have 298 patients in the hospital, but we also have about close to 35 patients in the emergency room who are still waiting to get in to the hospital. And the reason why they are still in the emergency room is because a lot of these patients would require either a ventilator or a high-flow oxygen machine, so need oxygen ports. But we cannot accommodate them inside the hospital. So dun muna sila. No? They stay in the ER, so the ER becomes an extension of the ICU setup in our COVID facilities. So that's one. So we're full. And again, there are also a lot of people in the wait list. We have, I just checked this morning, there are about 100 patients who are confirmed COVID. About half of them are needing high-flow oxygen or ventilator that wanted to get into PGH. And some of them are in their households waiting for our transfer command center to accept them. So the waiting line is long. There are ER patients waiting to get in. And so the way that we're addressing it is we have to close some more of our non-COVID facilities so that we can open up more beds that have available oxygen ports.
And ilan ho ang inyong pwede niyong buksan? Kasi ang dami po nun, Dr. Jonas, if there's over 30 in the ER waiting to get in, para lang ho that's clear, ibig sabihin, makakuha po ng kama sa ospital, because nasa ER sila. And there's over 100 on wait list. How many beds?
Mga 40 po doon sa wait list. Kailangan may high flow oxygen din. Tapos yung
and
iba naman ay...
ano na po ang kailangan nila? Yung sinasabi niyong kailangan na ng high flow, ibig sabihin nun, kailangan na ho din silang maipasok sa lalong madaling panahon.
Kaya most of them will probably try to find a hospital, na iba pa, And the problem is a lot of these hospitals are also full. So I can just imagine we have a lot of our kababayans who are probably really needing oxygen and they're being treated in their own houses. Siguro they have their oxygen tanks. Some are trying their luck, trying to go hospital hopping and going to ER, just hoping that they can get in.
Wow. So you said that you will open non-COVID beds to COVID patients. Ilan ho pa ang kayang buksan ng PGH? Not just beds, Doc Jonas, but together with the healthcare workers needed.
Actually, ang ginawa namin, nagsara kami practically na isang non-COVID ward. Nag-open kami ng COVID ward. But you're right, Pinky, it's not just the beds, and then it's not only the oxygen ports. Now we're also experiencing shortage of manpower, may mga nag-resign at may mga ilan pang mga nurses minsan nagre-resign. Madami din po nagkakasakit, So nakakabawas po sa workforce when somebody gets sick, and then obviously when we do contact tracing, there are those who are exposed. So we also have to quarantine them, so nababawasan, As you know, PGH is primarily a university hospital. We have a lot of trainees, residents, and fellows from the different departments. And one way that we decided to try to solve the manpower shortage is to ask other departments, primarily those who are not dealing with COVID, mga surgical or cutting departments. So for example, kasi mostly internal medicine ang humahandle niyan. So the director has a request that all departments should be sending out some of the residents, parang yun nga,
para tumulong na.
Balik na, tulong-tulong na. Kahit na hindi mo pa talaga specialty yan, magpapadala. And that's what's been happening. just to augment. And even with that, kapos pa din, no?
Wow. But
because
Doc
we have
Jonas,
other non-COVID patients pa na we have to take care of.
opo, meron yung balita ho kasi na may nag-resign na mga doktor. 10 po yun eh. Is that from PGH?
Yes. Well, 10 po yun na DOH po yun na volunteer. Ano po yun? Sineldohan po yun ng DOH. I think they were earning about 50,000 a month. Wala naman po kami masabi dahil nagtrabaho sila sa PGH, and their decision to leave, syempre personal na po yon. So we honor that, and we have to, and nung nag-resign, malaking kawalan po sa amin yon. Syempre, the more that there was really a need to have this task sharing scheme, no? Talagang tulong-tulong na. So just to give you an example, in fact, even the pediatric department, no, because most of the COVID patients naman in PGH are adults, no. We have a small segment that are from the pediatrics. So most of the pediatricians are taking care of kids. But since there's really a shortage, and our internal medicine residents, fellows are getting sick, no, being exposed to this COVID for quite some time already. Even the pediatric residents will have to pitch in, no. Anyway, all of us are general doctors naman to begin with. So,
yeah.
Hindi naman kaya naman yan. Pero just to give you an idea that we're really trying to mobilize as many as we can.
Doc Jonas, I just have a follow-up, no? And I have 30 seconds left. Doon po sa 10 na nag-resign last week sa PGH, sabi nyo nga na DOH doctors, why did they resign? Kasi ang dami po nun 10.
We don't know. Alam mo, hindi ko unfortunately, Pinky, I cannot tell you their individual reasons. Maybe I can just hypothesize. Maaring napagod na din. Maaring iba, nagkakasakit. So they may probably look at PGH, masyadong maraming trabaho. And then the truth of the matter is they can probably be earning more if they just work less work, higher pay outside, no? Kasi ang narinig ko minsan yung sweldo na 50,000 a month to a lot of people, that's not enough, because if they can moonlight somewhere, they can earn like twice as much.
100,000. Okay. So Doc Jonas, will continue to speak to you and find out the situation there at PGH. In the meantime, we'd like to thank you for your time, Dr. Jonas del Rosario. Thank you, sir.
Thank you.
And thank you for joining us here on The Source. I'm Pinky Webb. You're watching CNN Philippines.